Well, to discuss this, I'm joined in Melbourne by Dr. Vincent Cornelisse. He's a sexual health physician and the co-author of Australia's PrEP guidelines. And in London, we have author and journalist Matt Cain, who's been using PrEP for the past few months. Gentlemen, good to talk to you. This is a fascinating discussion. Dr. Cornelisse, let me start with you. Does PrEP work?
PrEP works extremely well, Imran. Thanks for having me tonight. PrEP is the most effective way that someone can protect themselves against HIV. It's more effective than condoms in typical use. The problem with condoms is that effective use of condoms relies on someone putting on a condom at the time of sex. And as we all know, the time of sex can be a time when it may be difficult to put on a condom. Often there can be some alcohol involved, or it's late at night, or it's dark, or you just don't have a condom with you. PrEP separates that. So with PrEP, you just take one pill in the morning, and you take it when you brush your teeth in the morning. And if you do that every day, then you know you're not going to get HIV.
Okay, so Matt, I understand that you use PrEP, you like PrEP. Let me tell you what Michael Weinstein told me. I spoke to him a couple of years ago. He's from the AIDS Healthcare Foundation, the head of the AIDS Healthcare Foundation in LA. He told me PrEP was a bad idea. Why? Because it stops people from using condoms, and now we're seeing an explosion of gonorrhea and syphilis and so on. Do you have sympathy for that position?
Do I have sympathy? No. Well, I think if we have a drug here that effectively vaccinates against a major lifelong and expensive to treat condition, we shouldn't not use that simply because it doesn't protect against much more minor infections that are very easy to treat with the course of antibiotics. I think what's going on here is a similar thing to what happened in the 1960s when the contraceptive pill was introduced and women were slut-shamed, and there was this narrative that it would encourage women to be promiscuous. Well, frankly, what's the problem if they want to be? And I don't feel like I should have my sex life or my habits criticised or morally judged. I think I'm doing the responsible thing by taking PrEP, and I don't think it has encouraged me to be any more promiscuous.
Matt, let me ask you for clarity, how do you get your PrEP? Because I know it's quite expensive. I know in the US a lot of people can't afford it. How do you get it?
Well, in the US, any gay men who have healthcare policies, insurance policies, they get it automatically on their policy. In Europe, it's still under patent, so it's very expensive, about £400 a month. But you can get it. In the UK, we have the National Health Service has a PrEP trial, which you can get it for free. I get mine via I Want PrEP Now, which is a website which sources it from other countries, like Thailand in my case, where it's come off patent and is therefore much cheaper, around £30 sterling a month.
Okay, so Vincent, is that wise? Matt needs it. He gets it through Thailand. Is that, I don't know, something that you find normal and wise and acceptable?
Yeah, so in Australia, we're quite lucky. We now have PrEP on the government list, so people can access it here with fairly low costs. But that is a fairly recent change. And prior to that coming in, and prior to our large demonstration trials that we ran over the last few years, people were self-importing here as well. So people were ordering it online because otherwise it simply was not affordable. I mean, it's about $700 per month to buy it privately. So if, unfortunately, there are situations in which people need to buy it online. It's not ideal. Obviously, there's a chain of custody issue in that it's just coming through the mail, and you can't necessarily guarantee that it's been under ideal conditions during the transit in the mail.
Right.
But unfortunately, that's something that people sometimes need to rely on.
Okay, so Vincent, to the Michael Weinstein point of things like syphilis and gonorrhea, the rates of gonorrhea infection among men who have sex with men have been climbing. It was at about 4% in 1989. It's at just under 40% now. That's not good. Now, of course, there are multiple factors. But do you accept that there's an argument from the other side to say, well, you know what? We just finally got ourselves into creating a condom culture. I remember in San Francisco when I was making a documentary about this, there were a lot of gay men who were middle-aged, who said, we saw our friends die in the 80s. because they didn't wear condoms, and now they fear that all of this stuff might come back. There's a massive trauma connected to this. Is there validity to that argument?
There, in a way, I mean, I think what's really important is to separate the two. So PrEP is HIV prevention, and that's all it's ever claimed to be, and it's extremely good at doing that. It's not STI prevention. Condoms have played a very important role through the 80s and 90s and 2000s in preventing HIV and preventing sexually transmitted infections. But they're not perfect at it. They don't prevent all transmissions of HIV, and they certainly don't prevent all transmissions of other sexually transmitted infections. So syphilis and gonorrhea can be transmitted through types of sex that don't normally involve condoms. For example, oral sex, and gonorrhea can probably be transmitted through tongue kissing as well. And I don't know anyone who uses condoms for that. So I think it's important that we conceptually separate these two. HIV prevention is one thing, STI prevention is a separate thing. And as a medical community, we do need to find better ways to prevent sexually transmitted infections other than HIV.
Okay, Matt, you want to jump in?
Can I say something here? Yeah, STIs in general, things like gonorrhea and syphilis, were on the rise anyway before PrEP came into use. And actually, the amazing thing about PrEP is, if you think about the HIV/AIDS crisis and the aftermath of it for a good decade after the combination therapy came in, when condoms were our main tool of preventing HIV infection, rates went up and up and up. And it's only now, for the first time since HIV/AIDS was discovered, that rates of infection are plummeting. And there's parts of the US, like San Francisco, for example, where they're almost at a zero infection rate, because PrEP use, coupled with the shame and the stigma around HIV being diminished, and therefore people are more likely to test, and if they're positive, they're more likely to get on drugs. These drugs make them undetectable, incapable of passing it on. Okay. So if you've got those drugs and widespread testing on one hand, and on the other hand, PrEP, this is the future for HIV prevention, and it's really working in the way that condoms weren't.
Right, this is the future, and it's working. So then, Vincent, help me understand. If we have something that if you take it every single day, it works like a vaccination against HIV. HIV was a terrible tumor on the world for a long, long time. If we can win the battle against HIV with PrEP, why is it still so inaccessible around the world? And why are so many countries and their different health authorities still skeptical about it?
I mean, sex has always carried stigma, and unfortunately, that stigma has been translated to PrEP in some settings. We've been lucky in Australia that we've had a very strong grassroots support for PrEP here in Australia, and the community involvement in rolling out PrEP has resulted in the fact that we really don't have much PrEP stigma in Australia, but I know that situation is very different in, for example, the United States, where, as you mentioned, the AIDS Healthcare Foundation was very anti-PrEP. And I think a lot of this pushback comes from sex stigma. I don't think it's necessarily based in rational health economics. If we only looked at health economics, then it makes sense to prevent HIV infections, because HIV infections are very expensive to manage. So if we can have a drug that prevents them, then it makes sense for governments to support it. But
okay.
I think...
Right. A final word from you, Matt.
I was just going to throw in another word. As well as stigma, I'd like to throw in and suggest that the word prejudice is relevant here, because HIV/AIDS is still, in the West, a disease that disproportionately affects the gay community. And I think, there is still the hangover of us being considered, in the 80s as we were, disease-carrying sexual predators who weren't to be trusted. And I think this is still breaking down in some quarters of Western society. And I think this is partly what's at play. I think people are squeamish about combating it because they don't like to think about the reality of gay men having sex.
Okay, yep. And it's been interesting getting your perspectives on PrEP. Thanks so much for joining us on the program, Vincent Cornelisse and Matt Cain.